Office of the Director of Pharmacy and the Drugs and Therapeutics Committee of the hospital as part of management's management strategy to improve the quality of services rendered to patients. The hospital is most grateful to you all for your time and presence here. I'll take this opportunity to commend highly the Director of Pharmacy and his team for the newfound consistency in the organization of this all-important annual workshop since its reactivation last year, after years of break. Rational use of drugs is of paramount importance in any healthcare setting, as it is a proven indicator of the quality of clinical services rendered by health facilities. It is thus appropriate that as a hospital striving to be a leading center of excellence in the provision of specialist clinical care, special attention and efforts be directed at cultivating a culture of prudent use of medicines as part of the drive to optimize patient care outcomes. This workshop aimed at sensitizing the hospital's core healthcare professionals involved in the prescription, dispensing and administration of medications on the contemporary practices in the rational use of medicines is therefore most welcome. Distinguished ladies and gentlemen, the choice of optimizing the use of opioids, a review of the main issues, challenges and strategies as the theme for this year's workshop could not have been more apt. In dissecting the theme, the following key topics: clinical use of opioids, new psychoactive substances, a threat to the regulation of controlled substances, prevalence and impact of opioids abuse among health workers, and management of opioids, regulatory perspectives, would be some of the key issues of attention at this workshop. Pain is one of the most common medical complaints on earth, if not the commonest. It is a condition that can adversely impact on the physical, psychological, and emotional well-being of sufferers, resulting in a number of debilitations, including sleeplessness, immobility, poor appetite, and general reduction in the quality of life. It is significant to note that opioids have emerged as one of the most effective remedies in pain management, resulting in their widespread use as they bring considerable relief to sufferers. However, many chronic sufferers do not have access to effective pain management for a variety of reasons, including limited access, restrictions, personal and cultural biases and misconceptions. The widespread use of opioids in contemporary pain management practices has thus become one of the most complex and globally challenging topics in medical care. Distinguished ladies and gentlemen, as health workers, our daily differences in the use of opioids for pain management has not only brought to the fore the critical role they play in alleviating unbearable suffering among patients, but the distinct challenges that come with them as well. These challenges include clinical access issues, regulatory pressures, and currently the disturbing rise in the incidence of their misuse and abuse, even among healthcare professionals. With greater access to these medications, healthcare providers are at a higher risk of misuse due to the stress-prone nature of their professions and easier access to controlled substances, among others. Opioid misuse within the healthcare sector does not only pose personal health risks, but also negatively affects the quality of patient care, professional integrity and standards, and general healthcare delivery system. Addressing these challenges would require multifaceted approaches and tactics, including discrete and sustained rehabilitation and other support services for healthcare workers, strengthening of mental health programs, and stringent enforcement of institutional policies that promote greater accountability and care for those at risk. This is very crucial because it's only by prioritizing the well-being of healthcare providers that the protection of both patients and the quality of healthcare systems could be assured. Distinguished ladies and gentlemen, in Africa, the clinical use of opioids is limited by a unique set of challenges that deny many patients the much-needed relief. low levels of opioid utilization across the continent, and limited statistical data for medical opioid use indicate that cultural and social barriers exist with regard to opioid use in pain relief. For instance, while the global mean consumption of morphine in milligrams per capita was almost 6 in 2010, majority of African countries consume less than 1 milligram per capita, with the exception of South Africa. Many healthcare systems in Africa face significant restrictions and complex regulations, leading to a drastic undersupply of opioids in some countries, thus rendering effective pain relief inaccessible to a large portion of the population. The fear of addiction and misuse often leads to restrictive policies that unfortunately hinder access for patients who genuinely need these medications for pain management, such as those with cancer, trauma, or post-surgery patients. Distinguished ladies and gentlemen, to address these, there is a need for a balanced approach that ensures effective regulatory oversight, while also expanding the education and training of healthcare professionals on the appropriate use of opioids. Personal prescriptions of physicians and patients, as well as restrictions within healthcare systems, contribute to the unnecessary suffering that results from non-existent or inadequate pain management services in Africa. The personal biases of physicians and healthcare professionals and their inadequate pain education and training levels, particularly in the areas of pain assessment and management, have also not helped matters. This can only be remedied by improved pain education in undergraduate and postgraduate training of these professionals. In conclusion, our global and regional challenges surrounding opioid use for pain management call for a balanced, comprehensive approach that considers both the essential need for pain relief and the significant risks posed by misuse. We must prioritize responsible, accessible opioid use in Africa, strengthen regulatory responses to new psychoactive substances, and address opioid misuse, including within our healthcare sector. By working collectively, we can develop solutions that do not only address immediate pain relief needs, but also uphold the integrity of our health systems. Together, let us strive for a future where effective, compassionate, and responsible pain management is universally accessible. We can all work towards ensuring equitable pain relief without sacrificing the responsible use of opioids. Before I bring my address to a close, I would also like to thank the Food and Drugs Authority for their collaboration and Rush Ghana for the sponsorship of this workshop. It's my hope that as a hospital, we can continue to count on you in the years ahead, and as we strive to improve the capacity of our hardworking staff to offer world-class pharmaceutical services to the public. Once again, thank you for coming. Wish you a most productive workshop, and may the good Lord richly bless you for your attention. Thank you.